All right. We're getting this a lot more frequently now. We have been probably for the past couple of years, but um, anytime you want to share a set of data with an external collaborator, we have to make sure that the data is defined appropriately in terms of the category that the HIPAA privacy rule has for different data sets. And this slide just shows you what those three categories are. So we have full protected health information, which we're able to share under some circumstances that I'll get into in a moment. We have a limited data set, which is technically PHI, but it removes several of the actual HIPAA identifiers that the privacy rule identifies, and it leaves things like dates of birth, dates of service, and location data. So that's limited data set. And then we also have a de-identified data set, which removes all 16 identifiable data variables, including dates, including location. And there's a corresponding agreement for sort of each of these data sets that I'm going to get into right now. So if you're sharing protected health information, there are two ways that we can do it, two different types of agreements rather. And they're all called data sharing, data use. It's all just to share data. So don't let the nomenclature of the agreement type hang you up. It's just these are the mechanisms that we use. So if it's protected health information, which includes any one of those identifiers that I just talked about, it's a data sharing agreement. And that's specific if it's a research purpose, and we have to identify that purpose in the agreement, and it can only be used for that specific research purpose. Separate and apart from that, if it's not research, we could do a business associate agreement. We are a covered entity as a hospital system. The recipient of the data has to be considered a business associate, which is another HIPAA term of art. Tina, sorry. Um, the limited data set is also a HIPAA term of art. And so specifically, the privacy rule calls out that if you're going to share a limited data set, you have to include a data use agreement. And the data use agreement has to have specific data variables, or sorry, not data variables, specific elements to it that enable us to share that data set. And then the last agreement type is data sharing agreement as well. Same as if you're sharing PHI, but this one for de-identified data specifically calls out the data is de-identified, so it's not considered PHI. You can go to the next slide, Tina. So what do we need if you want to share protected health information? So if this is considered a research project, the first thing and most important thing that you need is an IRB approval, right? And a lot of times you're getting that IRB approval, you're going out, you're interacting with patients, the patients are consenting and they're authorizing you to share your data or to share their data. And if they do that, we can put a data sharing agreement in place to share the PHI. If you're not interacting with the patients or the IRB has approved a waiver of authorization, we can also share protected health information in that circumstance, but we need documented approval from the IRB, and we absolutely need a data sharing agreement if we're not actually getting patient authorization directly from the patient themselves. If it's a non-research project, so it's quality improvement initiative, something of that nature, we have to have what's called the covered entity business associate relationship, which means the business associate has to be doing something on our behalf. So think of this in the same sense of like we have an EMR, right? So Cerner, I think, is our EMR. They are definitely a business associate. We are telling them, hey, as a covered entity, we need to share a bunch of PHI with you. You're going to help maintain that PHI. That's a business associate function. We have a business associate agreement in place with them, so we don't need to go out and get patient consent and authorization for Cerner to basically be our electronic medical record. For us, at MHRI, it's much more common, obviously, for the research project component of this to be applicable. We do have a few scenarios where we do BAAs, but it's a little rarer than the research. Next slide, Tina. So if you're sharing a limited data set or a de-identified data set, you still need to make sure you get IRB approval, or if for some reason it's not considered human subjects research, what we're asking is that you have IRB documentation from somebody in ORI or on the IRB that says we do not consider this to be human subjects research, therefore you don't need IRB approval. If that's the case, regardless, we still do a data use or a data sharing agreement. Long story short, essentially the data sharing or data use agreement is almost always going to be required. It's just depending on the data set, whether the IRB approval itself is actually going to be required. And so the second half of this slide is if it's not considered research, right? So again, just document that for us whenever you put it through, and we'll get the data sharing agreement in place with your collaborator so we can share that data. Next slide, Tina. And so Ashton and Melissa already kind of showed everybody the intake form, so I'm not going to go through that whole process again. If you want us to do a data sharing or a data use agreement or any kind of data sharing agreement at all, you're going to work with your SCA or your project team to put the request in through intake. When you put that request through, what we ask is that you tell us what directional flow the data is taking. So are we sending data out or are we receiving data? If in either case, what we want is that IRB approval or that documentation of non-human subjects research. If you have it in hand, we generally ask for it before we really start the process or before we execute the data use or data sharing agreements. And we also need to know exactly what data variables you intend on sharing, especially if the data is going out the door. Part of the reason is, and I didn't talk about this on the first slide, is there have been a number of times in the past where we have an investigator or a project coordinator, somebody coming to us and saying, hey, we want to share this data set with our collaborator, but it's a de-identified data set. We say, okay, like, can you tell us what data variables you're sharing? And it turns out that it's either a limited data set or a full set of PHI. So we ask for that up front because we need to make the appropriate determination as to what we really require at the time that we're negotiating the data sharing agreement. If you give us everything at the time you're putting it through intake, we'll basically pick that request up. We'll begin negotiating the data sharing agreement. And different from the CTA timeline, if we have everything, it's about a 30-day to execution timeline if all of the different elements are present.